Hello everyone. The next topic I'll cover is the facial hemiatrophy. First thing, what do you mean by facial hemiatrophy? Facial, that means involvement of your face. Hemiatrophy, hemi, that means half of the face or half portion or unilateral involvement of face. Atrophy, that means it is decrease in the size of any body part. Okay, so that means facial hemiatrophy. These are some other names of facial hemiatrophy. First is Parry-Rumburg syndrome, Rumburg-Parry syndrome, progressive facial hemiatrophy, and progressive hemifacial atrophy. So these are other names of facial hemiatrophy. Originally, this lesion was described by Parry, Henoch and Rumburg. So according to the scientist name, it is known as Parry-Rumburg syndrome. This lesion is a slowly progressive atrophy of the soft tissues of half of the face. You can see in the picture there is atrophy on the right side. This is a young girl having right side atrophy or right side facial hemiatrophy. This is characterized by progressive wasting of subcutaneous fat accompanied by atrophy of skin, cartilage, bone and muscle tissue. So what are the etiological factors that causing facial hemiatrophy? First etiological factor is the cerebral disturbance that leading to increased and unregulated activity of sympathetic nervous system, which in turn produced the localized atrophy. Localized atrophy means there is a particular area that's showing decrease in the size. Some other investigators suggested that these are some factors which could be a cause of facial hemiatrophy, like your extraction of teeth, local trauma to the tissue, infection, mainly viral infection and Borrelia infection, and genetic factors. So these are factors that could be a cause or etiology of facial hemiatrophy. And many investigators believe that hemifacial atrophy that represents a localized form of scleroderma. Scleroderma is an autoimmune disorder, and in scleroderma there is a thickening of the and inflammation of the skin. This is a cutaneous lesion. Coming to clinical features of facial hemiatrophy, the condition begins as atrophy of the skin and subcutaneous structure in a localized area of the face. The most common early sign is painless cleft, and this cleft is present near the midline of the face or forehead. In the picture you see the arrow mark, there is a cleft. That is the boundary that marks between the normal and the atrophic tissue. The right side of the patient is the normal tissue and the left side of the patient is the atrophic tissue, or the size is reduced. So there is involvement of ipsilateral salivary glands and hemiatrophy of the tongue. Ipsilateral, that means the same side. If unilateral involvement of the right side of the face, so the right side salivary gland is also involved. Okay, ipsilateral, that means same side. Its opposite is contralateral, that is the other side. So there is ipsilateral salivary glands involvement, hemiatrophy of the tongue, and unilateral involvement of the ear, larynx, esophagus, diaphragm, kidney and brain. There is unilateral involvement. And this condition starts in the first decade, that is first year, 10 years, and it lasts for about 3 years. Okay, starting from 10 years of the age and last for 13 years of age. This condition is also accompanied with pigmentation disorder. For example, pigmented facial nevi. So if the lesion is there, the atrophic side, there is reduce in the size, as well as there is a color change. Okay, like abnormal facial color. When you compare male and female predilection, females are more affected as compared to male, and right side and left side is mostly affected as compared to the right side. Next is oral manifestation, that is the abnormalities seen in the oral cavity. So in dental abnormalities, first is incomplete root formation. So root formation is not complete. Okay. Next is delayed eruption. So the eruption is delayed. For example, in permanent maxillary central incisor, it erupts at the age of 7 to 8 years. In case of facial hemiatrophy, it may be erupt at the age of 9 to 10 years or 10 to 11 years. So that is delayed eruption. Then severe facial asymmetry. There is the facial symmetry is not there. Hemiatrophy of the lips and the tongue. There is unilateral involvement of tongue and the lip. There is unilateral reduction in the size in the lip and the tongue, and retarded eruption of teeth. Coming to histopathologic features, that means we are seen in the microscope. These are microscopic features. So there is atrophy of the epidermis. There is variable perivascular infiltrate of lymphocytes and monocytes. These are inflammatory cells. These are seen in the connective tissue. These are light microscopical features. In light microscope, you see the atrophy of the epidermis and there is a infiltration of lymphocyte and monocyte. But in electron microscopy, you see there is a degenerative changes in the vascular endothelium. So what are the differential diagnoses of facial hemiatrophy? First is post-traumatic fat atrophy, hemifacial microsomia, that otherwise known as first and second branchial arch or pharyngeal arch syndrome, and golden hair syndrome. These are the differential diagnoses of facial hemiatrophy. So coming to treatment plan for the condition, there is no specific treatment for facial hemiatrophy. The disease will be progressive for a period of several years and it remains unchanged for the remaining of the patient's life. So these are all about the facial hemiatrophy. So basically there is a unilateral involvement of the face and atrophy of the face. There is a reduction in the size of the face. That means there is facial hemiatrophy. So I just covered the introduction part, clinical feature, what are the etiological factor, oral manifestation, histopathology, and your treatment plan for this condition. I hope you like the video. Thank you so much.